Hello and welcome to the Business Tech Insights podcast. I'm your host, Brad Nelson, and today I'm joined by Dr. Mark Whitefield. Mark, can you introduce yourself, please?
Yeah, Brad, I'm an implant reconstructive dentist here in Nashville. I'm a fourth generation dentist, but in reality, what I am, I'm a startup guy. I am an entrepreneur, and what I specialize in is all the AI tools that we're using in dentistry and how we apply them to get people real teeth again.
Yeah, that's really cool. So what kind of things are you working on in your startups? I know before we started recording you mentioned like AR glasses and stuff
Yeah.
for doing implants. I want to hear more about that.
Well, to be honest with you, you're looking at them. These are the Meta Ray-Ban glasses, and I've used them for about 2 years now, and in my area of surgery and in dentistry in general, we use a lot of magnification. A lot of doctors use loops, which are like they're microscopes for your head, and, what these glasses do, I have magnification built into them, but these are, they're AR-based AI-based optics. These do not have AR capabilities, but we've got new models that are out now, or new eyes, smart loops that are combining AI capabilities with AR surgical softwares, and the area of AI optics is just blasting out, and it's just kind of crazy how these glasses right here, they were the genesis of it about 2, 3 years ago, and they're gaining a lot more popularity, but it's just amazing the capabilities. I use them all day, every day in surgery and also outside the office.
How does it assist you in surgery?
So these glasses, what you're looking at right here, these are the Meta Ray-Ban glasses, and they've got several other models that they have introduced over the past while, but these are quite wonderful. What my company does, one of our divisions, our AI optics division, is called Evo Vision. And what we do is we put custom magnification lenses into these AI frames. And what the capabilities are is number one, it's got a camera, and the camera it's a phenomenal camera. So we're able to take hands-free videos and pictures in surgery. It's all voice activated. I'm able to take those pictures, send them to another surgeon, send them to my lab, send them to my front desk. Uh, that's the optics end of things, but these are basically an iPhone for your head. And so we use
Hmm.
them for communications. My staff members have them. I've got other doctors that use them. And, the audio capabilities are amazing. They really are. And so you'd be surprised how many different ways that I use these. But then on top of that, it's got Llama in it, which is basically
Hmm.
ChatGPT functionality, and I'm able to, it's amazing what you can do with them just by taking a picture and asking questions. Oh, and then the one of the ultimate takeaways is we use them for translation with patients. We have a lot of patients
Oh.
from, different places. I'm fluent in Spanish, but, it can translate English, Spanish, French, Italian, and German, but it does it on the fly. So we get patients here in Nashville, we got a lot of people from all over the world now, and now I'm able
Mhm.
to communicate with them, but it's all built into the glasses. It's all there.
Wow, that's really cool.
Yeah,
So
I'm telling you,
you
they're
can have a
stupid cool.
conversation with basically anybody in it. So then I'm assuming that it displays what they're saying. Like if somebody was speaking to you in German, for example, it would then display what the translation is in English on your glasses. Or oh, uh-oh, I lost your audio, Mark.
Oh, is that
Oh,
better?
yep, you're back. You're back.
Okay. Sorry, I was trying to show you where it shows up on your phone. Uh,
Oh.
like as far as display, but it actually reads or translates in your ear. But
Oh,
then, what you're referring to probably is the new model that's coming out, the Meta display glasses. And I've
hmm,
tested those, and they do what you're talking about. They have a heads-up display. It's amazing. I mean, it is crazy good. And so that's the new, generation that's coming out, and it's coming out right now. They're releasing it, and that's what's gonna really change things in the world of translation.
very cool. Now, I'm assuming that, your experience as a dentist, your ideas for these startups and these new ideas came from troubles that you had in your practice. Is that correct?
That's exactly right. 100%.
All right. And what are some of like the basis for some of these ideas that you've had to start these startups?
Well, I have one, parent company, Whitefield Biomed, and underneath Whitefield Biomed, we've got 3 well, we got about 4 different divisions of, what we call our innovation stacks. One is the AI optics division, another is our software, which we, have for categorizing it's our library of content. So
Mm.
when we, take these videos, you gotta put them somewhere and store them and collate them. And then, because I'm an implant reconstructive dentist, my original, um, my original innovation was what we call Flex on X, which is, it's a new bridge. It functions like real teeth again, and we're making full mouth, implants affordable for the average old person. So those are our innovation stacks, and what I had to do is I had to create a company because I didn't have anywhere to put these things. And so, Whitefield Biomed is pretty much an R&D bio hub where we
Mm.
use it as a laboratory. We do a lot of research and development, but, it's all based upon the fact that there are just an inordinate number of AI developments coming out every day. And in dentistry, we use about I use about 6 different kinds of AI tools and technologies, both clinically and for admin stuff every day. And so we're fast becoming the centralized ecosystem for AI in dentistry.
That's cool. So, I mean, of course, I'm assuming you use it in your own practice. It sounds like it.
Oh yeah.
Do you, are there other practices that are using your innovations and stuff as well?
There are. I'm kind of the I'm kind of the crazy Elon Musk guy. Everybody thinks I'm nuts, which is fine. But well, what it is it's we've been using AI for several years different ways. Clinically, facial recognition, photogrammetry. We're also using them now with some admin things with patient communications, getting insurance information, these type things. We've got tools that are coming down the pike now, but historically, dentists, we don't know anything. I mean, I'm telling you nothing as far as what's out, how to use it, that kind of thing. But the tide is turning, and now dentists are becoming much more open-minded. They're looking at it. They're wanting to find out, hey, what does this do? What tools are out there? The problem in dentistry, I'm I'm a fourth generation dentist. We've been doing dentistry for like 125 years in my family, and the way that dentists are taught and trained is archaic. And
Huh.
so there's no central oh, it's appalling. And it's I hate to say this applies to medicine too. There's no central place for a doctor to go and learn. I mean, they don't know who to ask. Our manufacturers, our schools, institutions, I mean, they just have no idea. And so that's what um our education platform is called Arch Intelligence. And that's where dentists come to it's our school. And that's where dentists come to learn and see. They see what the newest, latest technologies coming out are, but more importantly, we show it to them, we teach them how to use it, and then we also show them, "Hey, if you do it this way, this is your ROI and how it makes you much more efficient and a better doctor.
Very cool. So with this learning platform, is it mainly for other dentists, or is it for just general folks that want to learn more about what they can do to improve their teeth too? Or
Oh, we've got both. Mostly everything's been geared towards teaching the dentist to provide it because that's the big, I mean, those are my people. That's the biggest need. But we are launching we're launching public education things about teeth because that's another area that's just a big fat chaotic mess. If somebody has problems and they want to learn about implants or cosmetics or what they should do or whatever, or how much it costs or who can provide the service or whatever, it's just not good online. And so that's what we're doing. We're trying to be the clarifying voice, the really go-to authority that really tells people the truth of what's happening. And so we're addressing both ends of the marketplace.
so being a fourth generation dentist, and you're saying that the education is somewhat archaic. So do you feel as though you were taught basically the same way as your, great
That's what
grandfather or whoever down the line?
Yes. Yeah, they
Wow.
unfortunately, that's exactly right. My dad, he graduated in like 66, and then I graduated in 95, and they taught me the exact same way they taught him. We didn't have technology. And then here's the
Yeah.
funnier sad thing. Now in 2026, they still don't teach the new students, you know,
Hmm.
they don't teach dental students really much about technology. They might show them one small little part of it, and they do use some technology, but in reality, that's the reason we created Arch Intelligence. So when the doctors, they're once you're out of school, you really don't know where to go to learn this stuff. So we
Mhm.
created the platform to teach them.
So why do you think it is lagging behind like that? Is there one thing that you could point to, or
It's I study a lot of startup stuff. I've studied all the masters from Peter Thiel and Mark Andreessen and Ben Horowitz and all these guys. And I've read a lot of books in that area because I mean, I don't know anything about startup or innovation. And there are certain business principles. Like,
Mhm.
for example, we rely a lot on the big corporations to bring us information, bring us new innovations and stuff. But the problem is they're not real good at it. Uh, the academics are they're just stuck. And there are a couple of books. One is Crossing the Chasm, which is an older book that tells you, and they explain it out very, very well why it's so difficult to bring a new innovation to the marketplace and have people adopt it. There's another book called uh, The Innovation Stack, and it tells why these innovations are so important. And then there's another one called The Innovator's Dilemma, which what it does is it fleshes out and it tells you why it's such a troublesome thing. It's because and the problem is everything they say in the books is really 100% true. You just kind of think it's not. You think surely not. People aren't this myopic or obtuse or blind. They are, and it's just that basically you can't teach an old dog new tricks. And I
Hmm.
was, and that's why I'm a little embarrassed about the way that we educate folks. But we're working hard to change that.
Yeah, cool. Now, how long have you been doing some of this more innovative stuff? Is it a fairly new
Um,
thing, or been going for a few years, or?
I've always been an innovator, and an entrepreneur at heart, like a true founder startup kind of guy.
Mhm.
When I see the problem, I try to make some stuff up to fix it. Um, and I'm in. in implant dentistry and reconstructive dentistry, dude, you gotta make stuff up on the fly all the time and
Hmm.
try and fail. When you're building people back together, it's so complex. Uh, in the past, just before COVID, things were really starting to get a lot of traction with AI tools. And I recognized early on, I'm like, hey, this tool that I use over here is very effective. And so I delved into it about how it works, what they do and stuff. But then I started looking, oh, this is good. Now this is good. And I realized very quickly, there's no central authority who knows what's going on. And so and then, since COVID, it's been a tsunami of new innovations and tools that come out. I mean, I was on a phone call with my tech team earlier today, or just a few hours ago, and man, we were talking about it like now every 20 minutes something new comes out. And so we're
Hmm.
it's and they're good and effective. So we're just in a special time in history, and it's all these things putting together are allowing us to do better dentistry for our patients.
Yeah. Well, it seems like technology is never linear growth. It's always exponential. You hit that certain
Yeah,
milestone, and then it just starts rocketing up. Especially with like the AI
yeah.
stuff. If I feel like I was hearing about AI stuff, you know, 6 to 10 years ago, and it was very clunky and in its infancy and stuff now. But now there's a lot of these AI tools that are coming out that are really actually useful, and there are AI chatbots that are passing the Turing test and all sorts of stuff. Overall, do you think AI is a boon for humanity, or do you think it could be our downfall?
Oh no, I think it's a miracle that we really need. I mean, I'll just tell you
Mm,
that right now, because the end result, it's in the healthcare industry. We're just at the very first innings, and already we're coming up with absolutely miraculous results, not just in dentistry, but in medicine. Like, we're coming up with new antibiotics, the new meds like GLP-1s. They're phenomenal. They are adding longevity and years onto people's lives. Uh, I've got patients that are undergoing custom cancer treatments. They get into genetic genome, changing those around, mRNA stuff, which is way over my head. But it's those are areas that I mean, the other ones like in orthopedics, they're using the Mako machines to get joints in there real straight. I got a buddy that's a cardiothoracic surgeon at Vanderbilt. He does everything through the Da Vinci system. But
mm,
it is AI is going to add years onto all of our lives, and it's already doing it now. So I
mm,
think I get it. People are talking about, oh, they're concerned about it, they're scared. In reality, I look at AI, and this is what I preach about. AI is really just a digital research assistant. It only does what it tells you, what you tell it to do. And
hmm
we're getting better at stuff as far as AGI and all that kind of thing, but in reality, we're nowhere near, it being able to do its own stuff or the scary stuff or anything like that. People are using it for nefarious purposes, but those are already things that are illegal, you know,
right.
fraud and pictures and whatever they use it for. But in reality, I'm a huge AI advocate, and I'm just so thankful that we got it.
Yeah, yeah. No, I mean, it's like what you said. It only really does what you tell it to do. But like for me
Yeah,
personally, it saves me hours and hours of work. I used a lot for
me too.
helping to write documentation and
Yep.
policies and that sort of thing. And it takes something that, would take me 3 or 4 hours to sit down and write manually and turns it into like a 10-minute job. It's
Hey,
super slick.
I'll give you another example. I have to make presentations, like big in-depth PowerPoint keynote presentations, and I am not a graphic designer by any means, but the abilities like vibe coding allow me to build something that normally would take me hours and hours, but now I can do it pretty efficiently and it looks pretty good. So yeah, it just that's exactly what it does. It saves a truckload of time on the basic task and just makes our lives more efficient.
Definitely. Now, how do you, with some of the stuff that you're uh, doing with dentistry and AI, how do you ensure things are secure? Because I'm assuming that you need to be HIPAA compliant and, control
Oh
people's
yeah.
personal data. How do you ensure that you're using these tools in a way that keeps people's data secure?
Well, that's just the first step with anything that we do with in our office at administratively. We have a lot of I have a lot more information that I want to have in my computer system, but all of our softwares and the ones that come out that work with our CRMs with I mean it's a PMS, practice management system. I mean, they are everything is HIPAA compliant, and that's the first step for everybody. So we just take care of that on the front end. A lot of what we do clinically, it just doesn't apply. We're not sending off any personal information anywhere and that type thing. One other thing you bring up a good point. Um, in the cybersecurity world, the biggest target far and away has been like healthcare and hospital systems and that type thing. Something like 60% of attacks go towards them. And we in dentistry have been running under the radar because, we're a very fragmented industry.
Mm.
So there are 250,000 across the US, and some of them are joined under corporate centralized administration, but some of them are single doctors or small groups like us. And we're seeing a lot more of attacks coming towards the dentist these days. And so, yeah, we have to up our game. And again, most dentists, we don't know anything about technology. I mean, we just don't, whether it's admin or clinical stuff, we struggle with it. And so that one thing, that's an area that, we're definitely keeping focus on, and we're doing well with it. We're doing well protecting ourselves.
Yeah. Well, I know, from the cybersecurity side of things, the it seems like there's a lot of legacy systems in healthcare in general. I'm sure it's the same with
Yeah.
dentistry, but there's
Yes.
MRI machines that still use floppy disks that are being used. And so,
Really?
and it seems like hospitals sometimes are, oh yeah, yeah. Uh, Sometimes
Hmm.
hospitals are slow to upgrade. Like there were quite a few hospitals that were still running Windows XP after it lost support, just because,
Sure.
it was stable and it was working. But the problem is then it was insecure. So, and
Yep.
and then speaking from with the AI stuff, there are some AI tools out there now for cybersecurity where it's basically like an auto hacker AI thing that people have been creating and testing. And on one hand, it's a good thing because then it can help you find vulnerabilities in your system and patch them. But then this tool is out there for people who have malicious intent as well, So it's
Of
it's one of
course.
those kind of double-edged sword things for AI in general. So, uh, what do you think? You were saying that dentistry has been kind of flying under the radar up until recently. Do you see cyber attacks as a big problem in dentistry in general?
Yes. Um, we know of I mean, you hear stories, and then we've been really studying or researching this area for a good long while because we are, cyber security is something that we've been looking at for 10, 15 years at least. And like we have cybersecurity insurance policies.
Hmm.
If we get hacked and they get in our office and take our stuff, the federal government can literally levy $100,000 fine for each occurrence, which means
Whoa.
they could literally level a $10 million fine on a dentist. And so they don't do it
Wow.
because they don't, but it's and so we've really been, well, for example, years ago, we had a closed system. I mean, we protected everything as best we could. And we had a closed system, but then because of insurance companies, the insurance companies run the world, and
Mhm.
they made us go online. And when you go online, it just opens you up to fraud. What was it? The biggest scare that we had was about a year and a half, 2 years ago. There was a United Healthcare hack, and they cut real quick within a day or two. They cut off the APIs to our. They closed all the APIs to our practice management softwares. And when I saw that, I was like, "Ooh, that's a that's a that if they I can't even imagine how bad that would have been if they got into all the dental offices." So and that API hasn't come back yet. So I mean,
Oh,
this is way over my head, out of my league. But as far as that goes, we've been cognizant of this for years, and we do well. We do well considering that we're out on an island by ourselves and all that kind of thing. We talk amongst ourselves, but but they're getting better. So that's what's scary to us.
oh yeah. Oh, definitely.
Yeah.
Definitely. Well, what kind of things are you doing to um, kind of defend against that and prepare for those sort of things? You mentioned cybersecurity insurance as definitely a good step. Is there anything else you guys are doing to
The
help prevent that or
cybersecurity
prepare?
insurance is the cybersecurity insurance. I'm not even sure it's worth anything. I mean, we have
No,
to legally have it. I mean, I don't think I
sure.
think if we get hacked, I think you just screwed anyway. Then it's not like they're gonna help you pay you money or anything. I've already heard, because what they have is they have all these pre-criteria, like you can have these firewalls, you gotta do this, blah, blah, blah. And if you don't do one of their things, they go, "Oh, we're not gonna pay." And so I've heard of that
Yeah.
happening before. Uh, as far as active prevention stuff, it's really not as much on the computer end of things. It's the personnel. It's the humans that mess everything up. Whether one of my girls goes to a site that whatever, and they get in through that, or if somebody opens an email or whatever. So we're very aware of that, and our staff are like, "Hey, don't be opening stuff." But they're getting better at making them look legit, and so that's where
Hmm.
I think we're going to see more things coming. But we're
Yeah.
talking with our folks, and it's really a lot of staff training that we're focusing on.
Oh yeah, that's one of the things that we do is help with cybersecurity training and writing,
Mm,
you know, policies to make sure people are on track. But that's like the number one thing that we see is people um, clicking on malicious links in
yep.
emails or whatever. We
Mhm.
had one just last year. One of our clients got in the middle of. Thankfully, it wasn't them that got hacked, but it was a vendor they were working with that got hacked, and the attacker inserted themselves in an email chain that was already going between my client and somebody they were working with,
Wow.
and were able to steal almost $500,000 from the people that my client was working with. So
Unbelievable.
yeah, it was quite the situation. But like you said, they're getting more convincing, and I think that's another area where
Yeah.
AI is playing a part, because it used to be you get the email of I'm a Nigerian prince and I'm leaving you $90 million
Yeah.
or whatever.
Yeah, yeah.
Nowadays, I I would assume that these attackers are going into some sort of AI chatbot and saying, "Hey, write an email that sounds like, uh,
Sure.
here's a bunch of example emails. Write an email that sounds like this person saying X, Y, Z," and then it spits out something that's way more convincing than they could have written on their own because of
Mhm.
whatever language barrier or anything.
Yeah, you're exactly right. They're getting better and better every day, and that's the scary part, that again, the AI agents, you can use them for good or bad. And that's the
Yeah.
part that is like, "Holy crap, how do we These are the things that keep me up at night.
Yeah, definitely. Well, but it sounds like you are using them for good. Sounds like you're
Yeah,
innovating for your
yeah,
industry, which is good, which is what it needs to be. Needs to be for everybody.
yeah. It's you know, I speak to a lot of people, a lot of doctors. I speak to a lot of patients about it, because it and it's across the board. People are very leery of it. People are
Hmm.
they're scared. They don't. I mean, it's because they don't know. It's an extremely large, aggressive, unknown area. But and don't get me wrong, if one of these things happens to you, it's not good. It's pretty bad.
Yeah.
But the funny thing is I explain it like this: for every one thing that somebody uses it for in a malicious way, there's another million things that we use it for good. I mean,
Oh yeah.
it's probably to that point. And so I choose to focus on, tamping down the bad stuff or keeping it at bay. But nevertheless, I still think we're just in the very first innings. 3 years from now, 5 years from now, 10 years from now. Oh, we're going to have some wonderful tools that really do help us, live better lives.
Now, if you could dream big about what's to come in the next 5 to 10 years with all this technology innovation, what do you think might be possible in that time?
In my area, when it comes to healthcare, um, you're gonna see in my area of reconstructive implant dentistry, we're doing better surgeries. We're coming up with better results. We're coming up with better engineering technologies. They're giving me and my team better tools that make us better clinicians. And when I say that, we need all the help we get. And and so all these things we end up with better outcomes for our patients, significantly better outcomes. But then the other end of the scale is job efficiencies,
Hmm.
which saves on cost, knocks costs down, saves an inordinate amount of time. And the grand takeaway is this is infused into every part of the landscape. It's not just certain areas. I don't care if you're a teacher, a driver, a doctor, a football coach. I don't care. There are numerous tools that are coming out that are being applied in different ways. And that's it. This is a new frontier. Our motto at Whitefield Biomed is shooting over the horizon. And it's coming down the pipe. We're going to have things in my industry like, I mean, it's with our Mars system. It's here now. It's guided surgery. It's literally a targeting system lets me guide that implant 3D using AR capabilities, guide that implant to the most perfect position in your head. And
Wow.
then, uh, um, we've had, just communications with patients is much more streamlined. Um, Audio capabilities with these glasses. We're using these. I'm having a lot of older patients. I have a truckload of elderly folks, and we've got older folks that use these, so they use them. We're kind of encouraging our patients to look at them as a personal healthcare assistant of sorts. Old people need glasses. They need to see. A lot of
Yeah.
them have hearing aids. These things have their Meta's turning on hearing aid functions right now, which is pretty amazing. But then just, like, personal security, connectivity, if
Hmm.
they fall, if, they can call somebody, it's voice activated. And these are just things that, they're coming up all over the place here, and that's why I'm excited because we get a new innovation every 20 minutes, like I said. So
Yeah.
I'm just excited about what things are gonna look like on down the road.
Very cool. Yeah, I'm pretty excited too. And like you said, I think it's already saving us a ton of
Yeah,
time. And I think
yeah.
it's just going to continue to save us more time. Like I said, the stuff that we use, it takes hours and turns them into minutes for us. And it's,
J like we were talking about for the podcast, Riverside is doing a great job, then they turn on their AI agent. That saves truckloads of time in editing a video like, pod like this. Dude, give me more of that.
Oh yeah. Well, it's like, you click a button and it makes everybody sound like they're
Yeah.
using professional studio mics, and then you
Mhm.
click another button and it automatically kind of edits the layout and stuff. It's slick. I'm very impressed with this software,
Yeah.
Riverside. Uh, I really enjoy using it
I
because it
do too.
saves me time.
Yeah, and again, what is this? How do we define it? It is a digital research assistant, or it does little mundane tasks that most people don't wanna do, and it gives phenomenal results. That's the
Mhm.
magic behind it.
Yeah. Oh, definitely. Well, and like I mentioned earlier with the like writing documentation and stuff, either I would have to spend a bunch of time writing it,
Mhm.
or I
Mhm,
would
mhm.
have to have one of my guys spend a bunch of time writing it. And instead of having a documentation writer on staff or something like that, or a virtual
Mhm.
assistant, uh, then the the chatbot just gives you, it gets you like 85% of the way there, and you just
Yeah.
tweak it a bit and boom, you saved a
Yeah.
bunch of time.
Yeah.
Time and
It's
money.
wonderful. Yeah,
Yeah,
it enhances everything. It really does.
definitely. Now, so with some of the advancements in robotics and stuff, do you
Mhm.
think that that's going to affect your industry in the future, where you're going to be having robots do some of the surgeries or parts of the surgery?
It's funny you mentioned that because, there are 2 examples already, and they're already functional. One is, this is a system that is they call it a robot. It's not really a robot, but it's kinda close. Neosis or Yomi is the system, and it is they call it a robot, but it's not really a robot. It is a system that has an arm that guides the dentist with AR capabilities, not through glasses.
Mm,
That's what our system's gonna do is putting it into glasses. But we have systems that are dynamic navigation systems, and they've got one that's been used for a while. It's a little hard to use, but it's a very phenomenal system. That was the first robotics introduction into dentistry. Um, but they actually have a robot that's out now, and Dr. Ed Zuckerberg, who's I say a buddy of mine. He and I, we talk a lot and collaborate some. And at a meeting about 5 6 months ago, he showed it, and I'd seen some things on LinkedIn about it, but it is a robot that actually preps a tooth and does what you need it to do, and it's neat. It's coming out in 2027, I believe, but functionally, it's an amazing technology. And
mm,
so it's basically we use a lot of milling units and a lot of CAD CAM and technology to build teeth in the lab. We
mm,
work with metals and zirconia and resins and nanoceramics and that type thing. And we use a lot of milling units. And this
mm.
is basically an intraoral milling unit, basically, for lack of a better term. But they're taking the different um, technologies and putting the puzzle together. And so, yeah, we're going to have more coming down the road. Another thing along those lines, which is not necessarily robotics per se, robotics in dentistry is going to take a while, but we use other things to train dentists on how to
Mm.
drill. Another area which is not robotics is lasers, and
Mm.
um, one of my roommates from school. We work with a laser company, and we're kind of playing around and drawing out some stuff about how a laser could be used in conjunction with our CTs and robotics, and there's something there. To me, that probably would be an area that would really be up and coming over the next 5 to 10 years.
Now, with the lasers, are you talking about like a cutting laser to create
Mhm.
implants, or?
No, it's a cutting laser that cuts bone. It cuts the hole, the osteotomy that we put the implant into.
Oh, whoa. that
Yeah,
that
yeah.
sounds something out of science fiction.
Well, it is. It's a the laser technologies are great. This laser in particular is Photona, and it's a
Mm,
phenomenal laser. And they use it for surgery. It cuts bone, it cuts soft tissue, which is kind of what we do. Um, but to combine it into, when I say a robotic system, we use that term robotic loosely. This is more of a guidance system, navigation system is what we typically use. So the doctor's still in control of it. You know,
mm.
it's freehand, but we control everything. And as far as that goes, it's a matter of putting the pieces of the puzzle together, but we're making big strides on that. And it's going to be this is exciting. It's like Star Wars stuff to me.
Man, it
Yeah.
sounds super cool.
Yeah. So we work with a company. Photona is a company. They've got a great laser, and they're both a hard tissue and soft tissue laser. And when we say using laser in dentistry, we could use it on teeth, but we're surgical based people, and when it comes to implants, and so we're working on. Uh, we were talking about robotics. Working on, it's not necessarily robotics, but guided navigational surgery where it guides the laser into the proper position, because the big thing is when we're creating the osteotomy or the hole for the implant, it has to be very accurate. And so we're and that's to be honest with you, that's probably one of the biggest problems with training dentists to become an implant dentist, that they're it's terribly difficult, and it's hard to drill those holes in the right place and everybody squirming around and such. I'm really looking forward to see what we come up with in the laser end of things. And so we're looking to combine guided digital navigation along with the laser so that the laser can cut the osteotomies, which would lead to just much better results overall. So
Yeah,
that's just
yeah,
one example of what's coming down the pipe.
very cool. And I would assume, then there's less margin for error and the
Yes.
patient is going to heal better. And
You know, that's a very good point. That's realistically kind of the end goal, where the technologies allow us to eliminate or tamp down a lot of the human error. And there's a whole lot more than you think there is. And so if you can eliminate the human error in things, just outcomes are just significantly better.
very cool. Very cool. Well, Mark, we're running up on time. Any final thoughts you want to leave with our listeners?
No, this is great. You know, it's a breath of fresh air, because I talk to a lot of folks, a lot of professionals, a lot of non-professionals, and it's always a breath of fresh air when you get to talk with somebody who sees the future and the vision, and they're open-minded to saying, "Hey, we really need to do some research here. We need to see what's coming down the pike, and really have an open mind when it comes to AI."
Yeah, cool. Well, thanks for coming on. Where can people find you?
I'm located in Nashville, Tennessee. The best place to find me would probably go to our website, whitefieldbiomed.com, and that gives a good overall view of what we're doing in the R&D world. And there's going to be a lot more announcements. I'm also on LinkedIn. LinkedIn is a very good platform for a lot of scientific innovation and announcements. So those are probably the two best places.
Very cool. Well, thank you again for joining us, Mark. And for all you listening, you can find this podcast on YouTube and Spotify. And we'll see you in the next one.
Good deal. Thank you for having me.